Today we're going to talk about exercises for acute lower back pain. Hi, Dr. Corey Amberland of Bloomington Wellness Center, and today we're going to talk about exercises for acute lower back pain or for a lower back that's severely deconditioned. So those people who've come in with a serious lower back problem in recent history or have had a long-standing history of lower back pain and weakness, you have to get started somewhere. So we see a lot of people like this in our office, so there's some key exercises we want to show you to help you learn how to manage this chronic or even acute condition of your lower back. One of the first things that we have as far as challenges when it comes to doing these exercises is getting you in the appropriate position. Some with a serious lower back pain situation may not be able to get onto the floor. Therefore, you'll have to do the exercise on a bed, which is less ideal. On the floor, it gives you a firmer surface or an elevated surface that's firm. So the first thing we're going to have Zach demo for us is just the appropriate way to get onto the floor and not create a twist in your lower back as you achieve it. So very gradually laying down onto his back from the standing position. He may be helped by having a hand to lower him down as well if there's an assistant there. One of the main exercises that we'll use for an acute low back pain situation or for someone who is seriously deconditioned in their lower back is the pelvic bridge. So I'm going to show you pelvic bridge in a very simple way, and then there's ways to make it much more advanced. In the very beginning stages, it's the very simple is what we would go for. So the main element that people miss a lot of times with pelvic bridge is ab contraction. So there's a number of ways to contract your abs during the bridge. It doesn't matter to me a whole lot of how you do it. The simplest way, I think, is to press your abs into your fingertips and then using that feedback with your fingertips and your abs to hold it in that position. So the whole time we're doing exercises, we're maintaining ab contraction. For demo purposes, you can relax. But so then the next stage, and sometimes this is the only stage we can get to when the back is seriously deconditioned, is lifting into the bridge position. So right there is parallel with the hips and the legs. That is where we try to achieve in the bridge. Typically, if you hold it for a 3 count, that would be fine. And then you may repeat to a set of 10 or 12. It really is based on your level of pain as you do this. If you can do them pain-free, then you can repeat them and do a full set of 10 or 12, take a break, do another set of 10 or 12. If you can only do 5 before increasing, the pain increases significantly, then that's where you stop. So one of the next stages that we take people to after they're able to achieve this, it's just to make the bridge much more challenging, is to go ahead and lift yourself into the bridge position and hold. We're going to do it with marching. So let's have Zach bring one leg up, straighten it out, lower, not touching the ground, and bring back to neutral. So this is clearly one where it's going to be much more advanced. And if you're in a serious pain situation, you probably won't be able to do this. And then we do the opposite leg. Out, back up, and plant. So go ahead and do that one again for me. Demo it, straight out, lower, and plant it. This one, straight up to 90 and 90, down to the floor, and plant it. And then relax. So that again is something that you would do repetitions of it based on your ability to do it. So some people can do a large number of them. Some people in the very early stages of it can only do a few. The next exercise that we'll do is the exercise called dead bug, and you'll see what that means in just a moment. So I'm going to take it step by step, walking Zach through how to do this. There may be variations in this for you as you do it based on your particular condition. But to start, let's have Zach bring his legs up at 90 and 90, and we're going to just demo. Keep your arms down for now, and we'll go one leg out just above the floor and drop. The other leg out and drop. And so we can maintain that in this 90-90 position and elevate both arms. So for this, we'll just hold the legs still for now, and we're just gonna demonstrate how to do each arm back, just shy of touching the floor as well, based on how well your shoulder range of motion might be. And now we're gonna tie these together, both opposite arm and opposite leg movements. I'm gonna keep him from bringing his arm beyond neutral, but do an opposite arm and opposite leg. The legs return back to 90 and 90. It's nice to have a little helper when it comes to this exercise until you get your brain working and being able to stop these arms at straight vertical. The only other element to remember through all of this exercise is maintaining ab contraction. In the beginning, that may be very difficult, but as you get better at it, you'll start to condition that strength of your abs as you're doing the exercise. Thanks for watching today's video, and if you liked it, we release tip videos like this every week on our YouTube channel. So click here to subscribe or like us on Facebook.